Health Info, bringing you well-researched medical information. Our story today will be about a fictional flu patient. Aaron Smith is a first-year student at an engineering college and is an active person, taking part in activities such as band practice. Aaron hasn't been feeling well since yesterday. Aaron tells the doctor, "I feel like I was hit by a bus. My body aches terribly. I feel really weak. I am having fever but still feeling really cold, and I am shivering constantly." So what is happening with Aaron? Aaron's doctor asks some questions, and then carries out a medical examination. Aaron tells her that he is having constant nausea and threw up 4 times since yesterday afternoon when his fever started. The doctor also noticed some other signs when examining Aaron. Aaron looks lethargic and super tired. His nose is congested, and he is coughing with chest pain. Aaron also says that he is having a headache. Aaron is having difficulty breathing. His mouth and eyes seem pale and dry. His skin is warm, pale, clammy, and sweaty. Based on the information that Aaron provided, and the physical exam, the doctor decided that Aaron is having a flu. The flu or influenza is an acute viral disease that infects the respiratory system. Flu is spread through aerosol droplets through coughing and sneezing. Patients may feel tiredness, muscle and joint pains, and fever. Flu is usually caused by 2 main types of influenza viruses: Influenza A and Influenza B. Each has many subtypes and groups. Flu is contagious. It is important to know that patients can spread flu to others before they are aware they are sick, as well as during sickness. Most patients are contagious in the first 3 to 4 days after their illness. Some patients may start infecting others 1 day before symptoms develop and up to 5 to 7 days after becoming sick. Also, children, elderly, or those with lower immune status may infect others for longer. A flu is usually diagnosed by clinical examination, but there are a few laboratory tests available that can be used to diagnose flu. These can include cultures from nose or throat swabs, blood tests showing a high antibody result to influenza, and confirmed link to another laboratory confirmed case. How is flu treated? There are different ways by which flu can be treated. Individuals are advised that they should take their annual flu shots. This is especially true if the person is susceptible or vulnerable. For example, the elderly persons should take flu vaccines every year. If someone has mild influenza or flu, they usually get better with some at-home care. This can include taking lots of fluids, resting, and using pain relievers such as acetaminophen or ibuprofen. Patients with severe influenza may require additional measures such as antiviral drugs. Severe influenza is a serious concern, and patients may present with some additional symptoms that may require medical attention. For example, patients can have breathing problems such as shortness of breath, rapid breathing, and low blood oxygen levels. X-rays of the patient's chest may show signs of respiratory infection and disease. When the central nervous system of the patient gets affected, the patient may develop conditions such as encephalopathy and encephalitis, both of which are serious and require immediate attention. Patients with severe flu can easily get dehydrated, which can increase the chances of acute kidney failure. Also, if the infection spreads aggressively, a patient may undergo septic shock. Flu also worsens any underlying chronic conditions a patient may have, such as asthma, chronic obstructive pulmonary disease, chronic liver or kidney insufficiency, diabetes mellitus, or other cardiovascular conditions. So who should get immediate antiviral treatment? As per clinical practice guidelines by the Infectious Disease Society of America, 2018, some patients may require antiviral treatment. Not everyone is a candidate for antiviral therapy. Patients who should be given the treatment include patients who have been hospitalized because of severe flu symptoms, patients showing worsening of their symptoms, patients with chronic medical conditions or those whose immunity is compromised, children younger than 2 years, or adults above 65 years of age, pregnant women, and those within 2 weeks after delivery. Here are some natural and home-based flu remedies that can help improve your symptoms. Drink plenty of water to prevent dehydration. Take lots of vitamin C. Get plenty of sleep. Take warm fluids such as honey with tea, soups, chicken broth, etc. Take a nice long steamy shower or bath to open up the sinuses. Use salt water gargles to clear out the throat. And sleep with an extra pillow under your head to help drain your sinuses. In most cases, taking plenty of rest and staying hydrated help overcome the flu. But if you think you are feeling worse and are having difficulty breathing, immediately seek medical attention. Keep watching our videos to learn more about flu and other diseases. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.